Thank you so very much, Mr. President, Your Excellency the Ambassador, Mr. Chairman of the committees. We had this very interesting breakfast. And Mr. President, I really missed the breakfast at home because it was rather more intense, the breakfast we had today, so mine are more peaceful. Right, so before greeting and saluting this discussion and the conference, we need to acknowledge the challenges before us. With the end, so-called, of the pandemic and the completion of the pandemic and the bets and the issues we have in the future. So this is very important for Greece for the following reasons. Because the pandemic found us after a 10-year financial crisis where all sectors in health had problems in underfinancing and in understaffing even. And so we managed a pandemic with a national healthcare system that had just exited these conditions and with an industry that bore the problems of this past decade. And right when we believed that this would be the year where we would really have the focus of our finances and to correct these problems we have in health, we found ourselves in the energy crisis. So it does not mean that this government needs to secure the funds to actually make it happen, because everything depends on the energy crisis and it's not easy. And all this happens within an environment in which we have problems with regulatory issues and things are stuck. They haven't moved forward. Without underestimating what has actually happened over these past 10 years, in the part of health, we had and still have clawback, which is a central problem that needs to be faced by the pharmaceutical industry. We didn't have any structural measures because we always had the safety and the security that whenever we had a closed budget, no matter how much we go over it, we'll get the money back. So it's not as scary to take the regulatory and structural measures we need, until such time as the problem became gigantic and needs to be dealt with. Now, I will start on two levels. One part has to do with drugs and the second has to do with materials and health in general. In the reform part, and we have here Mrs. Diamantopoulou, who is one of the politicians who has linked her name with reforms very closely, and she knows very well when we're trying to do a reform, when everyone says, let's do it, people will be hurt at the end of the day. And when people are hurt, we're trying to see whether the reform will actually happen or not. And this, for me, is the pivotal point where we need to focus on. We're experiencing this in primary healthcare. It's something which you know very well, even if you do not come necessarily from the primary healthcare system necessarily. But in other countries, we have a doctor who is a point of reference for people, and it's linked with health economics as well. So in essence and in principle, everyone will agree, but once we try to establish this institution, people in situations are hurt because doctors, in essence, prefer the regime as it is now, the status quo, where there is no organized primary health care and you can easily resolve something by going to your doctor's private practice to resolve your problems, and they feel like some of their interests may be hurt, because they will need to enter into a contract with AOP where regulation will happen, or financially they will need to deal things in different ways. So this institution needs to be supported, and this is what we do, and we already have 4 million registrations with 36,000 doctors, and I believe that by the end of the year we'll have sufficiency of doctors for more people to join the platform. The same goes with pharmaceutical policy. 2,088 million for out-of-hospital retail, 528 million for in-hospital expenses. What happens to those with those budgets? Well, these budgets, if we look at them sincerely, have 3 levels. Are they low? Yes, they're low. They are low budgets. Is there overconsumption than required? Yes, there is more consumption than required. Do we have the structural measures to know how much actual consumption is? No, we do not. So how are we trying to deal with this? One thing which is very pleasant is that when the digital tools that we will be acquiring very soon in health, and yes, we're close in doing that. This is a reality. At the moment, the fact that we have approximately 250 million available for the medical file, the digital medical file, and the digital upgrade of hospitals is a very important thing that, yes, we will see happen very, very soon. We we believe that the awards will be completed by the first 6 months of 2023, so by the end of 2023 we'll be talking about their implementation. And as we said last year, these benefits will be reaped in 2024. At the same time, however, actions need to be taken that are conducive to all three directions. So regarding underfunding, things have already happened. There was something that happened when the vaccines were out of the budget. We have the beneficial clawback, in which part of the clawback may be reinvested by the companies or actually receive it through investments they perform. And yes, it is a question. The budget for 2023 in drugs will follow the increase of the country's GDP. So in the draft budget for health-related issues, we will have an increase that will be calculated on the basis of the projected GDP. At the same time, we have a target that has to do with the reduction of clawback. And if it's not achieved, at the same time, we have the 50 million clause of the country. And we believe that we will avoid that and we will actually make it happen. We broke down the budgets. And something that I mentioned in last year's table, I believe in this. It is a policy that I want to take it up on me, because if we have closed budget per category, we force the expensive categories to enter into negotiations, which they didn't, and give the discounts that we can get. And in my opinion, although at the first stage this may be shocking, you may find this shocking as companies that are innovative, you need to, compare this with distortions we had in 2010. And with more rational solutions to know what the budget is, if this budget needs to be enhanced, to enhance it, and we've already said that there will be enhancement of 60 million through the transfer of funds, and from the effect, some of the benefits and the profits they have will allow us to reach a number that is very close to the number that you had mentioned as a necessity. At the same time, you should know that we are enhancing the budgets, increasing the budget, and then we move on to the negotiations. Let's go to consumption. Now, fewer things have been done there, and it was reasonable because, well, in the midst of the pandemic, our priorities were different. Now, we have removed from the AOP the 10 most expensive categories. By the end of the year, we want, to be exact, by the end of November, to have treatment protocols, and the AOP has already sent prescription indicators for a series of other categories to Ithika in order for them to be introduced. So we're trying to touch on consumption, which is the big problem of the country. Because our big problem is not that much pricing, which drops to very low levels as a result of rebates and clawbacks. It's overconsumption. So that's our goal, that's our target. We have the categories, we have absolutely no problem to mention them. It's a demand of the industry that you represent, that we need to have clear protocols for innovative drugs to be received by those who really need it, so as to avoid overconsumption in innovation. Innovation is referring to expensive drugs. So we're moving in this direction, and it will actually yield results. Another series of requests. I mean, the President saw that in the morning discussion we had, I took out of my pocket the piece of paper I had last year and said, what we'll do this year. And many of these things were not pleasant. But all the things we said happened almost in their entirety. So another thing is that, yes, we do have low treatment value drugs, which, got a big part of the budget. And I'm talking about vitamin D. From 45 million closed, it went to 10, magnesium dropped to 8 million. And similarly, a category of drugs that completes the ministerial decision that will leave the positive list and will go into the negative list, because we don't think that they have the treatment value that needs to be reimbursed. And here I apologize for taking up too much of your time. I would like to mention 3 points because I accept criticism and I understand criticism. You represent companies and you are under pressure from your companies from abroad. But this is a health minister who took 3 measures that were not easy for any politician. First of all is that the uninsured enter the public structures. Going to the people and say that you can go to the public structures. Why? Because I need to open the drug expenditure, and to be criticized because by saying that you're doing this for the pharmaceutical industry to gain money was unfair. And it is unfair. It was a logical thing to do because there were, well, undeclared expenses that were not open for the Greek citizens. So it's a very difficult policy that in depth of time will have a benefit of 120 to 130 million per year. Now we'll probably have 30 or 40 million benefit in the first semester. It's been on since July the 1st. And the second very difficult policy is that although the previous government had decided that in drugs under negotiation there will be a reduction of the participation of the patient by 50%, we said that this burden the pharmaceutical expenditure of AOP cannot hold, and we returned the participation to the levels we had. Now we have an equalization of the retail price with the insurance fund price, and we know that there will be a small burden in very few categories, and I'm saying this to showcase that on behalf of the state, of the government, we didn't try to hide behind the problem. Believe me, the easiest thing 6 or 7 months before the elections is to leave things as they are, to let sleeping dogs lie. You will have the same rebate you had last year. But this shows that we really want to get into the problem, we understand the problem, and if we have wrong approaches, that the splits was not corresponding to the reality, we didn't have any inhibition to correct it after the discussion we had with you. So we need to look into the problem. And in this problem, the states, the pharmaceutical industry, and those who consume these services will have to shoulder the burden. And within this framework, I want to be optimistic. I will repeat what my dear friend, His Excellency, the Ambassador of the United States, to say, that the field that we have in the country and the development that will come is ahead of us, and it will be a rather difficult year. And in this difficult year, we will set rules that are linked to the burden created by clawback, by controlling consumption, and by supporting the budgets, which is the immediately next step. And it's certain that if we didn't have the energy crisis, things that have already announced, like supporting the uninsured, or supporting the budget in other targeted parts, or removing drugs that were used for the pandemic, they would have been implemented, for sure. But we're here to speak frankly and honestly. From the moment that we had different conditions, we had to prioritize differently and very, very fast. These things, in discussion with the Ministry of Finance, we will correct them as soon as possible. In terms of medical materials, we have already announced a series of central tenders. We believe in these central tenders, and in drugs we had several central tenders, public tenders. And now is the time, Mr. President, to implement the same thing with quality criteria. We set quality as a key priority because we want Greek patients to receive the best possible material and the best possible drug at the best possible price. And that was an objection we had as to how the minister sees you like investors or as costly parties. The Ministry for Health is interested in receiving the best product and the best price, for the best price. It's not the job of the Minister of Health or the Ministry of Health to do the investment work. It's the work of other ministries. We want to ensure that Greek patients will receive the best drugs at the best possible price by respecting the Greek taxpayers' money. It's the Greek taxpayer who pays for these drugs and for these materials. So it is with these thoughts, and knowing full well, Mr. President, that this discussion is being conducted under a heavy climate, primarily for the companies that do have innovative drugs that happen de facto to be the expensive ones and enter a closed budget that is more strictly controlled and with bigger burdens. I believe that these first measures, this first package of measures of the first year that I'm the head of the Ministry of Health, was like a firefighting attempt. So we're trying to enter into the structural measures, and we believe that with the support of the budget and the structural reforms and everything, we will have this framework that will allow you to be in a condition to say that we finally can see things and that we are not just watching a clawback grow ginormous.